All right. Hello, everybody. Good afternoon, and welcome again to USF Transition Research Seminar. And my name is Yu Zhang, and I'm Associate Professor in the Department of Civil and Environmental Engineering, and also affiliated with the CUTR Center for Urban Transition Research. So this seminar is sponsored by the CE Department, CUTR, and also 3 University Transition Centers, USF, including CTEC, COMET, and NISA. And also it's facilitated by the student chapters of the ITE and also WTS. So today we invited Dr. Nikhil Menon to talk about the impact of COVID-19 to the travel behavior based on a national survey that they have done recently. And Nikhil actually graduated from USF with a Ph.D. degree in December 2016. And after that, he joined the CUTR and firstly worked closely with Robert Bertini, who was the former executive director of the center, and then lately joined Dr. Payson Lin's group. And then Nikhil worked a lot related to transition planning, economics, and statistical analysis of transition data. So without further ado, I will give the control to Nikhil, and thank you for accepting the invitation and welcome.
Thank you. And good afternoon, everyone. We're doing it a bit differently these days, so doing well. So today I'm going to talk about the impact of COVID-19 on travel behavior and implications for telecommuting. So these are the results from a nationwide survey that was conducted in the summer. And I'm just going to talk about some of the main findings and some implications for telecommuting. So I'm going to share my screen and take myself off the video for bandwidth, just to make sure. And if you have any questions, I would like to have the questions. But if there are any other questions that need to be asked, please go ahead and raise hand or just interrupt me.
Okay? Nick, just to remind you, your voice sometimes is off. And also for other audience, if you are not talking, please mute yourself. And if you want to raise your question, you can feel free to unmute yourself. But just to try to maintain the quality of the presentation, okay?
Yeah, I'm not sure what's the issue with my voice. I hope it's not too bad.
Now it's better. Now it's good.
Okay. Yeah, I think I'll just keep my mic shut so that it might help to just from a bandwidth perspective. Okay. So can everybody see my screen?
Yes, we can see that.
Okay. Perfect. Great. So, like I said, we're talking about the impact of COVID-19 on travel behavior and implications for telecommuting. As you know, COVID-19 has had disparate impacts on many industries and many economies across the world. Transportation is one of the industries that has been impacted by COVID-19, with the need for social distancing and the risk of infection spread. There has been a lot of changes that have happened in the transportation space, leading to more strenuous hygiene measures that have been adopted by transit agencies, emergence of new business models as far as transportation services are concerned. There's also been changes at the person level where some of us who have the privilege to work from home have been working from home, whereas some others who may not have these benefits have continued to go to work using their limited means. From a city perspective, cities have also been have had to face a lot of changes in this new normal. There's also a potential for generating less revenue in the past year because of all the changes that have taken place. There's also a movement for creating more open spaces as as has been necessitated by the pandemic. This has led to, let's say, closure of some lanes, for traffic in order to ensure, more bike lanes, closure of lanes for, for increasing outdoor space, etc., etc. Transportation network companies like Uber and Lyft have also had changes to their business model and potentially exploring other sources of revenue as they try to combat the negative externalities that have come from the virus and the reduced, from the reduced demand for their services. We're in the era where vaccines have been introduced and close to 100 million US citizens and US adults have been administered vaccines, spurring the hope that the pandemic's end is in sight. But it is worth kind of taking a step back to understand what are some of the major changes that we seem to have seen in the last 1 year. Which of these changes are likely to remain the same even if COVID is no longer going to be a threat in the future? But which are some of the trends that are going to kind of tail the pre-COVID level trends? The graph on the right, as you can see, is from Apple tracking the mobility data. And we can see that over the past year, there was a steep decline in driving and walking, modes in around April and May of 2020. But we're seeing, based on the Apple mobility data, that the emergence of the new year and with more and more confidence in combating the virus, we're kind of coming back to the pre-COVID levels. And now there are exceptions to this, and one major exception to this has been transit, where you're seeing that there is a reduced patronage for transit and transit-based, routing requests that have been witnessed in the Apple Mobility portal. Now, this raises the question for us to investigate what are some of the changes that we are expected to see, and what are some changes that we are likely to continue to see once the pandemic is no longer a threat. So the CUTR-USF COVID-19 mobility study was conducted in the summer of 2020. It was a comprehensive stated preference survey that collected not just information since the onset of the pandemic, but also from a time before and hypothetically after. So when we asked respondents to respond to the after scenario, we wanted them to think of a scenario where the pandemic was no longer a threat to their society or to themselves. So what are the key objectives here? The key objectives are to understand how people's patterns and needs, residential choices, vehicle ownership, mode choice, use of shared mobility systems, trip making, and activity engagement will alter in light of the pandemic. In order to do this, we conducted a stated preference survey, online survey that was coded in Qualtrics and administered through Prime panels, which is also known as Prime. We received responses from all 50 states. Average response time was 16 minutes. We also employed some QA/QC procedures to ensure that the responses that we received were of good quality. We were left with a final clean sample of 2,400 respondents, and the findings are based out of these 2,400 responses here. As you can see, the chart on the right is kind of tracking where the respondents were at the county level, respondent location at the county level based on their residence and their zip code, etc. We're seeing that we have received responses from all 50 states. So of course, some states have much less number of responses than some others. But broadly speaking, we have touched upon most important metropolitan areas in the East Coast, in the West Coast, and also on the Midwest. We also received responses from a variety of different geographical regions, providing a flavor of the nation as a whole. Now, what did we include in the survey? The survey had 6 sections. The first section was background information, interested in understanding the demographic and household information from the respondents. We had 3 sections, the before, during, and after section. So those were section B, section C, and section E. So in these, we were interested in understanding the the information on vehicle availability, housing characteristics, employment, school information, and detailed trip making and activity engagement information that respondents provided 3 times. One was for a before COVID period, second one was during the since the COVID pandemic, and and the last one was hypothetically after one, whenever COVID was no longer a threat to them or the society. We were also interested in looking at shared mobility usage and activity participation, basically asking people what they felt about the strategies employed by shared mobility companies in the since the pandemic began. So the shared mobility companies were trying to adapt to the best possible extent in terms of changing the way they worked, some of their procedures as far as cleanliness and hygiene and other kinds of things were concerned, and we wanted to get a flavor of what people felt about some of these changes. Lastly, we were also interested in understanding the impact of the pandemic on emerging technologies such as autonomous vehicles. So, as you can see here, some respondent sociodemographics are presented in the slide. You can see that females are highly represented. We are highly overrepresented sample of women over men in this survey. But aside from that, we're seeing that almost all other categories seem to be somewhat indicative of a national sample. So we're seeing here how the different age splits are. You have a good split of different age categories. As with any other online survey, there is slightly a tendency to oversample folks who are more on the highly educated side. The majority of our respondents were white or Caucasian, but we also have responses from most other ethnicities across the nation. When respondents were asked about their technology adoption behavior, that is, where do they see themselves in that spectrum of adopting new technology, we found that a majority of our sample kind of light lying on the fence when it came to adopting new technologies. Most people would want to use them only when most people they knew started using them. On the other hand, there were at least 35% of respondents who were one of the who were sort of technology skeptics, as in people who were probably one of the last people to adopt some of these new technologies. Now, this was just in order to understand the kind of makeup of responses that we were likely to receive, and eventually to understand better how these responses came about and why people said the things that they said. From respondent household, from respondent demographics, we went to sociodemographics at the household level. And once again, we have a split of income at different levels. We also have a list of other aspects at the household level on your right, including the presence of young children, the presence of non-working adults, working adults, presence of older adults in the household, presence of members with underlying health conditions. We wanted to get a flavor. These are just qualifiers that we're using to better understand what is the composition of the respondent household from which the responses are coming to us. We also wanted to check, see what kind of households respondents were living in before the pandemic, and we are seeing that a significant share of them are living in were living in standalone houses, standalone homes before the COVID-19 pandemic. The line on the bottom, the darker shade on the bottom, indicates the people who had shifted household locations since the onset of the COVID-19 pandemic. And that's why you see that the darker shade only has 364 individuals. These are the individuals who moved during the pandemic to a different household. So we see that in that category, we see again a higher share of people who are moving to standalone homes, and also a significant majority of them who moved into condos and apartments. Looking at some other household demographics, we're seeing that in the pre-pandemic era, a significant majority of people in the survey belong to rented households. This kind of changed drastically from in the second sample, where we see that the sample of people who moved household locations since the pandemic seem to have moved into their own houses. When it came to household location, once again, we're seeing that in the pre-COVID era, the majority of respondents belong to suburbs, whereas among the people who moved houses during the pandemic, we're seeing that a large number of people migrated towards larger cities and also suburbs near larger cities. So this is kind of interesting to note that a lot of the share of people who move to these places seem to come from rural and small city, small town type places. It was also something of interest for us to look at the just those people who moved houses and compare their household income level, and we found that a significant majority of people who moved during the pandemic belong to some of the lower income categories. Now, this has equity implications in terms of what the pandemic may have and how the pandemic may have impacted some of these folks, and that's something that we need to be mindful when we're thinking about the future in this new normal. When we asked respondents when in future they would see themselves moving or changing their household location, once again, the pandemic seemed to have created a sense of uncertainty in the mind of respondents. Almost 1/3 of the people were not sure when that would be, and equally, more than 1/4 of the individuals thought that it would at least be a year before they made that decision. So since the survey was conducted in and around the July-August time, we're still not a year from that time. So this is probably the months, in this summer is when most people are likely to think of moving and making some of those decisions. Next, we're looking at vehicle purchase inventory here. Now, vehicle purchase inventory is the number of vehicles that are present in your household, number of motorized vehicles that are present in your household. We're looking at it in two respects. We're looking at it from the before COVID era as well as since COVID era. Now, the most interesting finding in this top graph that you can see is that the number of multiple vehicle households seems to have increased with since the onset of the pandemic, which means that there seems like a significant share of households have invested in new vehicles since the onset of the COVID-19 pandemic. In order to double check this, we looked at the vehicles purchased since COVID-19, and we found that 28% of the households did at least one vehicular purchase since the COVID-19 pandemic. On the other hand, we were also curious to see if there were any folks who sold some of their vehicles, and this was close to 9% of households who sold at least one household vehicle from since the onset of the COVID-19 pandemic. When we asked them when in future did they see themselves buying another motorized vehicle into the household, once again, there was large-scale uncertainty in terms of when that period would be. But on the other hand, we also saw a significant number of respondents who say it would probably take more than a year before I make that decision. As you can see by the 35.7 in the top chart there. When the same question was asked about selling one of their motorized vehicles from the household in the future, once again, the uncertainty looms with more than 40% respondents not sure what exactly they would do, but also a significant majority, which is 28%, feel that it would at least be a year before they make these kind of decisions. So these are some indications that the pandemic seems to have created a sense of uncertainty / stalled the way in which we generally progress with some of our lifestyle and daily activities. Next, we look at mode choice. We're looking at commuting mode choice specifically because that's of tremendous interest in this space. And we're seeing that, to not much of our surprise, drive alone seems to be the most dominant mode for commuting in the pre-COVID era. Look at the percentage of walk and bike in this, the lightest shade, which is at 2% in the pre-COVID era. The biggest mover in terms of from a pre-COVID perspective to the during COVID seems to be some of these types of modes. In the since COVID era, since the onset of the COVID-19 pandemic, you're seeing that the percentage of walk bike mode share has increased dramatically as far as commuting is concerned. A lot more people are using these modes for taking their trips. On the other hand, there's a decline in the use of public bus transit or rail transit as commute modes, and that has been accentuated by the difference in the shares that you can see between the two timelines. During this time, it's also worthwhile to see how drive alone has kind of stayed stable. So in the since COVID era, just for reference, these are for people who said that they are still continuing to commute during the COVID pandemic, and that's why you have significantly less number of observations there. When respondents were asked what they would do once the COVID pandemic was no longer a threat, once again, we're seeing drive alone domination. Not surprising. This is expected in a society like ours. But interestingly, we're seeing that a significant share of people would like to continue to walk bike once the COVID pandemic is no longer a threat. Also, we're seeing that people feel like they may return to using public transit to kind of the same share as they had before, and that's encouraging to say the least. Next, we were looking at understanding what are the changes that have happened in the different types of activities that we engage and participate in. In order to do that, I am presenting here a sample of activities that we investigated. Among them, the three that you can see here: attending a social gathering, attending church or religious service, attending a sporting event, concert, or play. As you can see, in the pre-COVID era, obviously there is a lot of involvement and participation in some of these activities for a large number of folks. A lot of us were going out, a lot of us are attending events, attending social gatherings, weddings, parties, going for concerts, and that is something that we're seeing in this sample as well.
Hi, Nikhil. There's some questions in the meeting chat. Do you want to answer them now, or you want to keep save them later?
Is it okay to answer them at the end? Is it okay to answer them at the end?
Answer after you finish the presentation, right?
Yeah.
Okay, sure.
Thanks. Yeah, thanks a lot. So we're seeing that, of course, not too much surprise, once the COVID pandemic hit, there was a drastic decline in some of these activities, and a lot of people responded saying that they did not do this activity since the onset of the pandemic. What's interesting here is the after part, and that is something that we need to think of when we plan for a future in a post-COVID and almost what seems like a normal world. When respondents were asked what they would do regarding these activities once the pandemic was no longer a threat, a large majority of them felt that they would go back to their pre-pandemic levels as far as activity engagement and participation went for these kind of activities. Almost 50% in all these events where they say, where they were saying that they would kind of do the same as before, if not more. In fact, that's more than 50% if you include the other two categories. Similarly, another set of interesting activities are grocery pickup, online order for grocery pickup, online order for grocery delivery. As we all know, a lot of us were not doing Instacart before the pandemic began. I may have used Instacart once before the pandemic in the last 1 year, in the last 1 year pre-pandemic. And that is kind of reflected in our sample as well, where a lot of people had the option but did not use it, or they did not even have the option. Whereas when it came to food pickup from a restaurant or food delivery from a restaurant, these numbers are slightly different because that is something some of us engage in from time to time. So this was the pre-COVID, this was the pre-COVID era. When you look at since the pandemic, we're still seeing a significant share of individuals who said that they did not order groceries for pickup or delivery. That could either point to two things. One is they either don't have the option still and they are reliant on going to the store in person, or there is an issue of access as far as some of these facilities are concerned, and not everybody has access to some of these opportunities that you or I may have. The same is observed in the food delivery and food pickup as well. Some of us may not have engaged in these habits since the onset of the pandemic for various concerns of infection spread, but there may have been others who may not have had the facilities or the option or the flexibility to do some of these activities. When they were asked what they would do once the pandemic was no longer a threat, yet again, we're seeing that a lot of people would not want to order groceries for pickup or delivery, perhaps meaning that they may go back to go back to the store. Equally, there are people who say they would want to do what they did in the pre-pandemic era, which means once again we're seeing this towing towards pre-pandemic trends as far as some of these activities are concerned. So when we summarized this information and asked them when in future would they participate in some of these activities, a large majority of respondents either were not sure or were tending to say that it would take a lot of time, at least a year, before they go back to doing some of these activities. Attending a social gathering, for example, almost almost half of the respondents felt it would at least be a year or more before they do that. So as you can see, there is large-scale uncertainty in terms of what some of these timelines would be. And mind you, this was in August or July 2020 when we were still undergoing through the peak of the pandemic. Maybe if we were to do the survey today, there is a lot more optimism and a lot more certainty on what some of these timelines may look like. Next, we look at shared mobility usage in the era of the pandemic. Now, shared mobility systems have been impacted severely by the new normal that we are facing, and shared mobility companies have resorted to a variety of strategies to try to bring back customers, so to say. So when consumers were asked about, when shared mobility customers were asked about their confidence level in using some of these technologies or systems, or any shared transportation mode, for instance, we were asking them, I feel confident that I will not get COVID-19 while using all these specific shared transportation modes. We see that the highest level of skepticism has been reserved for using rail or bus transit or Uber Pool or Lyft Share. It seems like respondents are unsure of the prospects, and they feel that there is some sort of a risk in using some of these transportation modes. Once again, these are surveys conducted in July, August. We are probably going to receive slightly different outcomes if we were to do this today in the era of slightly more confidence about the pandemic. When asked if they trust on the implementation of infection prevention measures, so we presented a list of infection prevention measures that shared mobility companies were doing, including installing plexiglass, trying to wipe down after every ride for ride hailing, wearing a mask inside the vehicle, turning down your windows to ensure the free flow of air. We asked how much they trust some of these implementation measures. And once again, we're seeing that there is a lot of distrust in what rail and bus transit agencies were doing as far as the respondents were concerned. Similar amount of skepticism was reserved for what Uber Pool and Lyft share drivers were engaging in as well, because you have a constant stream of people who are coming in and out of your vehicle, and respondents were not confident somehow that drivers were taking good care to ensure that they wipe down and they do some of these necessary, measures that kind of prevent the infection spread. We also asked respondents if they would never use any mode after taking the survey, and to our surprise, we found that a lot of respondents said that they would never be interested in willing to use bike share, e-bikes, or e-scooters. This is something that caught me off guard because I'm trying to think of bike share as a much more safer option than maybe some of the other modes. But that is certainly something where we need to pay some attention to see what's going on there. But on the other hand, we're seeing a higher amount of distrust again on bus transit and full ride hailing. When respondents were asked when they would use these shared transportation systems, yet again, there is a high percentage of people who do not want to use them. That the reasons for not wanting to use them may stem from some of their concerns, or also the fact that they don't have great access to some of these opportunities that are beyond them. We also were interested in looking at household income level once again versus using transit bus at least to the same extent, if not more, to the pre-COVID levels. And as you can see, the people who said that they would use transit bus at least to the same level, most of them were in the lower income categories. This kind of brings more focus and attention on the fact that maybe there are people who do not have the option but to go back at this point to using some of these transportation modes, even if they are not as comfortable or confident in the prospect of not getting contracted by the virus. So this is something that needs a lot of attention to when we are looking at curating policies in the future, because there definitely seems to be an equity angle that we need to consider in terms of how some of these outcomes may impact people of certain backgrounds. So what are some key takeaways from the first part of this presentation? The first major takeaway is that trip characteristics have changed since the onset of the pandemic. Shared transportation modes have been impacted severely, and some people who may have stopped using shared modes may never come back, and some others may not have a choice but to come back. So this remains a challenging time for transit and other shared mode operators in their quest to bring back this lost demand. Second, shared mobility systems, especially pooled ride hailing, seems like one of the most affected modes in this new normal. So they may need to invest in new resources that combat some of these negative externalities, or it may be the reason why we're going to see them engage in newer types of business models. One major business model that has kicked up somewhat during the pandemic is Uber Eats. Even though Uber Eats was present before the pandemic, the operation scale of Uber Eats in the last 1 year has been exceptional, and that is one example of a new business model that has added to our mix of options that we have. We're seeing that large parts of most activities, though they are currently curtailed right now because of our fear of infection spread, will eventually get back to pre-COVID levels. We saw a list of activities in the couple of slides before where we saw that even though people were not doing them today, they would very likely want to do them like what they used to do before when the pandemic is no longer a threat. The last takeaway from this is something that has been gaining a lot of attention these days, and that is that when people are moving away from the shared mobility systems and investing in new vehicles, as we have seen since the pandemic, there is a likelihood for additional VMT if our activity and trip engagement go back to pre-COVID levels. You can go back to that visualization from the Apple mobility data, where we are seeing that some of the activities have kind of come back to the pre-COVID levels, even though a significant share of people, including you and I, are still working from home. So now, if all of us were to go back to pre-COVID levels, it was likely that this would just lead to additional VMT than what we had observed even in the pre-COVID era. So this is something that to keep in mind. The second part of this conversation is going to be surrounded around telecommuting. So telecommuting, once again, is a privileged. We are all very privileged at this point to be working from home, to be able to have the option to work from home, and we have all been doing that for the past 1 year. And we're slowly getting to the era where employers are thinking of going back to some form of in-person attendance, in-person offices, maybe in the fall or in the spring of 2022. But this is something that this flexibility is something that very few of us have in reality. When respondents were asked in the pre-COVID era if they had ever telecommuted, almost 60% of them said that either they did not have the option or they had the option but never used it. Around 19% of the respondents in this survey said that they used to work from home all work days a week. Now, when this was asked in the context of the pandemic, we found that the number of people who didn't have the option drastically declined. So now only 36% of the people did not have the option to not work from home. Did not have the option to work from home, rather, sorry. But a significant share of individuals, the increase from 19 to 38, were working all work days a week from home since the onset of the pandemic. What's interesting here between the before and the since graphs is the interior categories. It seems like there is a slight there's a slight increase in some of the interior categories, indicating that perhaps there is more flexibility today about telecommuting than there was in the pre-COVID era. Now, it begs the question, what would this look like in the after period? So when I thought about this after period, I thought about two possible options, and I'm presenting both the options here. The first one is what I'm calling as likelihood. So this is likelihood is basically asking the respondent what they think their employer would do regarding work from home once the COVID pandemic is no longer a threat. So in the mind of the respondent, this is the likelihood with which they think their employer would be okay with them working from home. Now, if you look at this aspect, you're seeing that we're kind of tailing to pre-COVID trends as far as the extreme categories are concerned. The greater flexibility is coming in the interior categories. There is a growing sense that among employees that their employer may allow flexible arrangements for telecommute in the after COVID era. Meaning, there may be situations where employees may be able to work from home 2 days a week or 3 days a week, maybe not all days a week, but maybe 2-3 days a week, or maybe 4 days a week. And this is kind of reflected in the finding in this chart here. The next one is preference. Okay, we know the employers may think a certain way, but that may not be what we would want if the option was left to us. So the preference asks the question, if it were to you to make that decision, how many days would you likely, or how often would you like to commute to work? So here you can see that 20% of the people do not want to commute at all. Given the option, their preference would be to not to commute to work. Whereas there is 40% of folks who say that they, given the preference, they still want to commute to work all work days a week. So it seems like even though we may be getting adjusted to this new telecommuting reality, not all of us want to do this for the rest of our careers. There's a significant share of people who think, oh, I just want to go back to work. But once again, the interesting aspect is in the interior categories. The interior categories once again show the willingness / the interest for employees to want to have a more flexible work schedule, involving few days of work from home, few days of working in the office. So this is the difference between likelihood and preference that I'm really interested here. So to put it in simple words, in likelihood, I'm thinking of what the respondent thinks their employer would most likely do about telecommuting when the COVID-19 pandemic is no longer a threat. Whereas in preference, we're looking at, would the respondent want to commute to work? What would be their preference about this? Do they want to commute to work? Do they not want to commute to work when the pandemic is no longer a threat? So in order to model this, we're looking at 4 different models here. We want to understand 4 major aspects. So let's take this one by one. First, let's take the likelihood part. In the likelihood part, we're looking at 2 major aspects. One, whether the individual thinks they will have the option to work from home or not. So this is a binary logit model. Decision being whether the individual thinks their employer would give them this flexibility. Yes, no. On the other hand, if the employer gives them this flexibility, we're then interested in knowing, okay, how many days do you think your employer would be okay with you working from home? So this was accomplished using a random parameters order probit model of how many days their employer would allow work from home between 1 to 5 days a week. When it comes to preference, now it's again in a very similar fundamental aspect, but looking at it from two different points of view. On the preference, we are once again looking at whether an individual would like to commute to work. Given the option, do you want to commute to work, yes or no? So once again, this was accomplished using a binary logit model with random parameters. And in the second part, once you want to commute to work, what is your preference on your frequency of commute to work? How many days would you like to commute to work? So what are some key findings? The key findings are that there is a lot of difference in how our likelihood and preferences seem to influence our decisions. So this is just the telecommuting likelihood model here. Binary logit model. We're seeing that from an employer's perspective, respondents think that if you are highly educated, engaged in high frequency of virtual meetings even before the pandemic, you are more likely to have the option to work from home. On the other hand, if you have worked from home, if you have been working from home before the pandemic, even before the pandemic began, if you had a telecommuting job before the pandemic began, with the high frequency of engaging in virtual meetings, you were more likely to think that your employer would allow you to work 5 days a week from home. Conversely, if you had reduced use of mass transit, so people who said they want to use less and less of mass transit since the pandemic and after, once the pandemic is no longer a threat, these folks seem to be less likely to think that their employer would allow them to work from home 5 days a week. Now, what is the main outcome from the preference model? In the preference model, once again, we're seeing that mass transit reduction in usage since or after, both in the since and the after period, seems to have an influence on your preference to commute to work. So basically, people who said they will use transit less and less would like to, they would like to commute less to work. On the other hand, you can see all the green arrows at the bottom with the red shading, with the yellow, with the orange shading, the outline. Those are random parameters. So basically, random parameters are indicating the unobserved heterogeneity within your sample. That is basically saying that not everybody in your sample may think in the same way when it comes to some of these decisions. So the random parameters helps you to account for some of these differences. So it seems like even though you may be pro-tech adoption, even though you may be working from home before, even though you may have young children in your household, not everybody would like to commute to work, or vice versa. Now, when you look at the last model, once again, the reduction in usage of mass transit indicates that respondents have a lesser likelihood, lesser preference to commute to work. So we're seeing, in summary, that highly educated workers who live in the city and take part in virtual meetings frequently, even before the pandemic began, are more likely to think that they have the option later on as well. For those who are not doing these things, they feel like their employers may ask them to come back to work. Secondly, workers who have been working from home and extensively taking part in virtual meetings even before the pandemic perceive that their employer will let them work from home all 5 days a week. So this again has to do with your experience before. So this notion that we're going to be, telecommuting 100% is inconceivable. And most likely telecommuting will remain a much more fluid space with greater amount of flexibility in working arrangements. Individuals working in the fields such as healthcare and logistics and other fields that require more in-person attention to work don't perceive that they will receive the option to work from home. It's not surprising, but it's interesting that the model confirms what we think intuitively. Fields where you require a lot of in-person attention, where you have to go to work, they are less likely to be more open to this telecommuting regime. On the other hand, like I said before, individuals who have been using less of mass transit since the pandemic and who express their willingness to use mass transit less, even in the after period, are less likely to think that their employers will let them work from home for all 5 days a week. Now, this is really interesting and really critical because this means that there is a section of folks who are entirely dependent on transit for their livelihood, transit for getting them access to different kinds of opportunities. And because of this reason, it is important that transit continues to serve them for these trips. So people need to start using transit, and transit companies would need to do whatever it takes to get people back into their buses and trains. So the comeback is sort of critical because it may become a crucial cog in ensuring that people have access to some of these opportunities. Individuals who have been using less and less of mass transit and those who have been working from home very frequently were less likely to prefer to commute to work. Now, this is the preference aspect of it. Not all people who are tech savvy or work from home before or with young children in the household would want to work from home in a post-COVID world. And this is the effect of the random parameter there. Given the option to work from home, it seems likely now that only some people are likely to take that up. Other people have other kinds of factors, some of them may be unmeasurable here, that may be influencing their decision to go back to the workplace. Some of us may be missing interactions with our office mates, going for coffee break during the during the work hour with our friends, with our coworkers rather. And these may be some of those unmeasurable aspects that I'm talking about. Individuals who commute long, more than 30 minutes before the pandemic, are also less likely to want to commute 5 days a week. So it means that the telecommuting era may return, but only for some people. And that telecommuting is going to remain a flexible, fluid space with a workforce that is going to be flexible as well. What are some future topics of research in this arena? Now we looked at the pan-national trend as far as these impacts on travel behavior were concerned. It is critical to drill down to the most granular level possible in understanding further how some of these impacts may be on geographies and other socio-demographic determinants. This is important, just drilling down to the most granular level to understand some of these subtle changes may be important because it may become a crucial cog for future policy based on the new reality that we're living in right now. Impact of the COVID pandemic on commute mode choice. Commute trips are once again, we have a lot of focus on commute trips in the United States, and it's interesting to see how telecommuting and other ICT-enabled technologies may alter the space in the near future. Another topic that is of interest is the impact of the pandemic on attitudes and intentions to adopt emerging transportation technologies. A big example is the autonomous vehicle. A lot of attention has been devoted to AVs in the past 10 years, but now there is growing concern with this new regime of infection spread and riding with somebody who you may not know, etc., that may have influenced people's decisions to adopt these technologies today. So it's interesting and important to look at these aspects. And of course, we all want to go back to the era where we go back to our daily activities. So there's always a lot of interest in some of these topics. The picture on the right is from today. This was the cricket match that happened between India and England, and we had about 67,000 spectators inside the stadium. This is kind of the future, the idealistic future that we want to go to. But for many reasons, India seems to have adopted a different approach here, and we can see that there are lots of people around, which some of us may have become uncomfortable thinking about this in the past year. I want to acknowledge NCTR for helping us fund this research. I want to acknowledge my teammates, Mr. Brian Stace, Dr. Robert Bertini, Dr. Yai Keita, for working with me on this project. I also want to thank some of our collaborators on upcoming research, Dr. Natalia Barber, assistant professor from TU Delft. I also want to thank USF ITE for the opportunity for me to speak here, CTEC Tomnet Nicer for funding USF ITE's the seminar series, Dr. Zhang for her leadership, and also all faculty members from the civil engineering department who are fighting through the pandemic, teaching online, making sure our students' needs are met. If you're interested in working with me on this, I want you to shoot me an email and we can get talking. Once again, thank you one and all. We can go to questions now.
This is great. Thank you so much for this presentation, and it's very timely and a comprehensive study. I have to mention that I have a project meeting at 1 o'clock, so I have to excuse myself very soon, but I asked Jose Amira to help moderate the QA session for you. So Jose will take over from now on. And Nikhil, I just want to thank you again and see you around, and look forward to more cutting edge and the great work. Okay.
Thank you so much, Dr. Zhang. Take care.
Yeah. Thank you, everybody.
Thank you. Hi, Dr. Menon.
Hey, Hussein, how are you?
Fine, thank you. Thank you so much for presenting today.
Thank you. Thank you. It was a great honor to be presenting here. Thank you for inviting me.
Oh, you're very, very welcome. I'm just going to go through the questions that we had during the seminar. The first question is it possible for us to have a copy of the slides?
It is possible. For the copy, yeah, I can provide you a copy of the slides.
Okay, sure. Then we can use that on the recording to upload both to CUTR's YouTube so people have access to your presentation. One question says, did you revade survey results to address over and under sampling? I think this was asked in the first slides. Yes.
Thank you for that question. We are currently in the process of doing that. This is just the summarized results from the survey, but we are currently working on reweighting some of these to address some of the undersampling, oversampling issues. But keep in mind that it's not always possible to reach the most ideal mixes even with such samples. So we're trying to do our best in terms of making sure at least one or two of the sociodemographic attributes are sampled correctly, and that's something that we are currently working on right now.
Okay, thank you. One other question asks, did you have telecommuting offered as a mode choice?
That is a great question. So in hindsight, it would have been better to offer telecommuting as an option. Since we did not do that in the survey, basically what we were able to do was to collect information on people who were telecommuting and then collect people who had more choices. So then if somebody said that they were working all days from home, we were not interested in asking them about their mode choice. So basically, it kind of worked for us because we were able to combine the telecommuting numbers with people who are working, people who said they were not telecommuting all days a week. So in that sense, we have a sample where we can include them as an additional option, but we didn't do that initially during the survey.
Another question is, will you be conducting a follow-up survey to see if attitudes have changed?
That is one of my #1 priorities, and I'm looking for funding to help me to do that, because it would be very interesting to conduct longitudinal surveys over time to understand how some of these changes have taken place and how some of these influences seem to affect over time. Unfortunately, right now we're not. Nothing is in the books, but I never say never, right? I would definitely be looking to do something of this nature.
Yeah, and usually that leads to some interesting temporal findings as well when you.
Absolutely, yeah. And I think one of the main reasons why we love a data set like NHTS, the National Household Travel Survey, is that we're able to see these kind of trends, even though they are spaced 8 years apart in this case. But definitely a yearly or a more frequent survey would definitely give us much more interesting insights on some of these behaviors.
Definitely, thank you. Another question is it possible to have an access to the Apple Mobility dataset that you presented?
So the Apple Mobility dataset is available, it's open access. I haven't used their data specifically, but this is specifically available on the website. So if you go to, let me just put the right link on the chat. I think it's COVID-19 mobility. Let me just give me 1 second. Sorry.
Maybe we can postpone this later on because we are recording. We may want to do that after the recording is done.
Okay.
And I think that is all of the questions. I've covered everything. So if anybody has any other additional questions, please just raise your hand or unmute yourself to ask.
Any other questions?
I have one more question. What was sort of the most interesting trend that you observed when analyzing the results of this survey?
Yeah, I think the most interesting has to be what we discussed about telecommuting, because telecommuting, in the 90s and in the early 2000s, there was a big boom for telecommuting, in those years, and I think we had come to a point where people were interested in going back to their work locations instead of telecommuting, and that seems to have changed once again with the onset of the pandemic. And now it's a much more fluid space because even organizations are realizing that we need to be much more flexible about some of these arrangements, and that definitely has an impact on travel, trip making, and activity engagement. So that's definitely the most interesting thing for me from this. The other interesting thing, which again is on the shared mobility part, but I would reserve judgment to say anything on that until we spend some more time on looking at the data and trying to understand better on if some of those trends would remain the way they show in July and August.
Thank you very much. The work is very insightful.
Thank you.
We have one question, it seems. Is this work going to be published?
It is. We're actually working on some of these manuscripts right now. Definitely also looking to collaborate with anyone who's interested in working on other topics. So feel free to reach out to me. I'll leave my email in the chat just for everyone to take note. And if you're interested, definitely feel free to reach out to us, and we're looking forward to working with you as well.
Well, Dr. Menon, thank you so much for presenting and answering everybody's questions.